Welcome, everybody. Thank you for joining the 2022 North Carolina Advocacy Day event, where Mental Health America of Central Carolinas, NAMI North Carolina, and the American Foundation for Suicide Prevention North Carolina are coming together with one voice for mental health and suicide prevention. We have a great deal of information to share with you over the next 90 minutes. And as you can see by this list, we have several great speakers joining us today, and we're grateful to everybody for their time. Here's an overview of our agenda today. The executive director of each organization will say a quick word of welcome. We'll then have some opening remarks, provide you with an introduction to advocacy for those who may be new or who may not be as experienced as a field advocate. We'll then highlight some suicide facts and figures for our state and nationally, and then talk about the 3 policy priorities for this legislative session. We'll end with action steps that we hope you'll take to help us educate our elected officials and communities. And if time permits, we'll take any questions at the end. But again, please utilize the chat throughout the presentation. So to kick things off, let me introduce myself. I'm Cothren English, and I'm the Area Director for the American Foundation for Suicide Prevention North Carolina chapter. AFSP is dedicated to saving lives and bringing hope to those affected by suicide. Suicide is one of the leading causes of death, and yet suicide prevention doesn't get anywhere near the research funding given to other leading causes. AFSP works to create a culture that is smart about mental health through education and community programs, develops suicide prevention through research and advocacy, and provides support for those affected by suicide. In the last 10 years, AFSP has grown from a grassroots network of researchers and volunteers into a national movement of chapters across all 50 states and Puerto Rico. AFSP is the largest private funder of suicide prevention research, and because we've built the infrastructure to deliver evidence-based programs to the local communities across the country, our work impacts millions of people. Here in North Carolina, I'm joined by Sarah Cothren, who will be speaking later in the presentation, as the only 2 AFSP staff members. We're honored to work with a passionate team of dedicated volunteers across the state. And with them, our North Carolina chapter holds events throughout the year, including approximately 15 Out of the Darkness walks, a hike for hope, 5 to 8 Survivor of Suicide Loss Day events, numerous community education events and town halls, clinician and support groups, facilitator trainings, and loss and healing programs, to name just a few. You can go to afsp.org/North Carolina to learn more about everything we do throughout the state. AFSP consistently ranks as one of the best charities for mental health, and we're powered by everyday heroes like our field advocates, walkers, volunteers, donors, and sponsors. We're proud to partner with NAMI North Carolina and Mental Health America of Central Carolinas on today's event. And by being here today, you're helping us save lives. So please let me turn things over to Garry, Executive Director of NAMI North Carolina.
Good morning. My name is Garry Kreitz. I'm the Executive Director of the North Carolina Office of the National Alliance on Mental Illness. As a grassroots organization focused on supporting and advocating for persons who deal with mental health challenges and their loved ones, NAMI is pleased to join with our partners on this Advocacy Day. But to me, mental health concerns are more than just my job. For me, they're personal. As a member of the clergy who has spent untold hundreds of hours counseling persons in pain, but even more so as the father of a woman who has a mental illness, I am committed to making sure that the voices of these dear people who are too often marginalized are heard. Advocacy is one of the most important things that we do, and it works. Just last year, we saw the passage of Michelle's Law, which prevents unlicensed mental health facilities around the state. We saw legislation on early intervention. And while it's too early to know for certain, we may be seeing some movement on one of NAMI's highest priorities, Medicaid expansion, so that tens of thousands of people currently falling through the cracks might finally have the means to receive the care that they deserve. We hope that the 3 priorities we are discussing today will have broad bipartisan support as they provide essential services. Thank you all for your passion for advocacy and for giving up a Friday morning to join in on such an important discussion. It is my pleasure now to introduce my friend and my colleague, Kathy Rogers, the Executive Director at Mental Health America of Central Carolinas.
Thank you, Garry, and thank you, Cothren. Mental Health America of Central Carolinas is so grateful to have this opportunity to partner with AFSP North Carolina and NAMI North Carolina Serving Mecklenburg and Cabarrus counties, our mission centers around eliminating the stigma that continues to surround mental health. We support parents and caregivers, youth and adults who are living with a mental health concern. And a big part of our work is advocating for improved mental health systems and access to care. I'm so happy that we have our Director of Education and Advocacy with us this morning, Kevin Markle. He and his team do an amazing job teaching QPR, suicide prevention training, and mental health first aid. And then our Parent Voice team works with parents and caregivers who are really trying to navigate this complex system and get their children the best services that they need. Again, just thrilled to be here because as you saw at the beginning, our theme is one voice for mental health. And for too long, we haven't lifted up all of our voices. And that's what we want to do with first this event today and then going forward with other events working together. I'd hope you find the program meaningful and informative. And I hope you'll share comments, insights through your social media, again, using the hashtag OneVoiceNC throughout the day today. It is my pleasure to introduce our first speaker this morning. We are honored to have Deepa Avula providing opening remarks. Deepa serves as the director of the North Carolina Division of Mental Health, Developmental Disabilities, and Substance Abuse Services. Deepa joined the division in May of 2021 as Chief Operating Officer and Deputy Director after serving as the Chief of Staff and CFO of SAMHSA. During her 20-year federal career, she has provided leadership on policy, data, budget, and operations issues related to all aspects of behavioral health. We are so honored to have Deepa with us and want to welcome you to our first statewide advocacy event for 2022. And Deepa, thank you so much for taking time out of your busy schedule this morning. And I will turn the program over to you. Thank you.
Thank you so much. And thank you so much for the invitation to be with you all today. I take this work very seriously, both from a professional and a personal perspective. I think the value of conversations about mental health, the value of including different partners and different people in this effort is so very critical. And one of the things I must say is I love the title of today's event, One Voice. At the federal level, when I was working at the Substance Abuse and Mental Health Services Administration, one of the things to me that was most frustrating about the mental health stakeholder community was it was often not with one voice. It was often kind of disparate efforts fighting for a small little piece of the pie. And I think one of the things is to really highlight and lift up that what we all collectively want, what we all, no matter sort of the narrow aspect we might be coming from, what we all collectively want is individuals suffering with mental and substance use disorders to get the care and treatment that they need. And there are a lot of data that are out there about this. We know the numbers of North Carolinians living with these conditions is quite high, over 2 million individuals. Sometimes I hesitate to talk about just the data because it makes us forget that these are 2 million individual lives, family members, communities, really dealing with the consequences of mental health conditions in a very profound and very deep way. Sometimes when we just talk about the number, we forget what that really represents and what that really represents to people. And remembering that every single one of those numbers is an individual life and is a family. And we need to also recognize that mental health conditions really affect whole health in a way that I think we sometimes forget about. And when we talk about whole health and person-centered care, never is that more true than when we're addressing mental health conditions. We know that individuals with mental health conditions are more likely to have physical health conditions, are more likely to struggle with employment, are more likely to have housing instability, are more likely to be involved in the criminal justice system, are more likely to have trouble accessing care. We know that far too few people who need services for mental disorders get them. When less than half of people in the state and in the country get the treatment they need for mental disorders. And we know that untreated mental illness causes great strain economically, financially, socially, from a health position. So we know all of these things exist. We further know that all of these things have been exacerbated by the pandemic. And I think we cannot have a discussion, a meaningful discussion about mental health without recognizing that we are in a very, very unique time in this state and in this country relative to the strain on an already strained system. In North Carolina, at the Department of Health and Human Services, we're very fortunate to have Secretary Kinsley at the helm, who strongly believes in the value of investing in mental health, who strongly believes in prioritizing behavioral health as a priority for the department. We also recognize at the department that you cannot have a meaningful discussion about health without discussing mental health. And it's really core to what we know to be true of really having strong health, well-being, resilience. We know that without a strong focus on mental health, you can't have those conversations. A few things I just want to highlight that the department is looking at and doing. Obviously, you have partners on this call that I'm sure will talk about this, which is the implementation of a successful crisis system. And the federal government has mandated that in July of 2022, we move to a 3-digit phone number, 988, to access the suicide prevention lifeline. What we also want to make sure in North Carolina is that we're not waiting till the point of individuals feeling that they have to make a decision to take their own life. We don't want to intervene at that point. We want to intervene much, much earlier. And we want to be able to get resources to individuals who need them before they are at that serious a point. And in order to do that, we need a strong system of crisis services. So when I talk about crisis services, I talk about them in the context of really trying to avert a crisis. When we talk about the crisis system, it sounds as though you can only intervene at the point when an individual is already experiencing a crisis. I want us to do better. I want us to do better than that for North Carolinian communities and families. I want us to intervene earlier and really be at the front lines of trying to prevent a crisis from even happening. How do we do that? We do that by training individuals and families and school personnel on recognizing signs and symptoms, on things like mental health first aid. What are the things you can do to notice if your friend or family member or neighbor or child is struggling? And when you do notice that, what do you do? And I want there to be services and supports in North Carolina that are readily available in an equitable way to provide services at the right point, in the right setting, at the right time. I think it's very, very important to be able to do that. And we will be focusing on looking at our community-based services. One of the things we all want as a goal is to ensure that services are provided in the least restrictive setting possible. But in order to do that, those settings have to be available. They have to be able to respond quickly and respond with the capacity that we need. We also know that that leads to a very important discussion around our workforce. Our workforce is so strained right now. It is so under-resourced, and we need to be sure that individuals are able to provide the services and supports they need. And we need to take care of our caretakers as well. We do that by paying them adequately, compensating them for their time. We know this work is very, very difficult. We also know that the specialty field alone cannot do this. We must engage our primary care workforce. We must do trainings and education and really take away the stigma associated with not just living with these conditions, but also treating these conditions. When we talk about stigma, we often don't talk about the stigma that doesn't exist among the healthcare profession. We have to break down that stigma in order to ensure that an individual who is being treated for a mental health condition receives the same type of care, the same access to care as an individual being treated for a physical health condition. And again, how do we do that? We do that by mainstreaming this type of education in our healthcare professionals' curriculum before they become full-blown practitioners. If we start to teach and train on these conditions early on in the educational trajectory, we will be less likely to experience some of the stigma that we have later as practitioners start to practice healthcare and medicine. We also know that in order to do that, and when I'm talking about all hands on deck, I'm also talking about a system of integrated care. In North Carolina, we are implementing the tailored plans. I think, as everybody knows, at the end of the calendar year, we will be implementing tailored plans. And really the premise of tailored plans is the focus on an integrated care model. We'll be looking at other evidence-based treatments for integrated care, recognizing again, the physical health and mental health co-occurrence is very, very high in terms of issues related to physical illness and mental illness. And in order to really fully treat an individual, when we talk about whole health, we have to do that at the same time, in the same location, to the greatest extent possible. We also very much recognize the value and importance of including individuals with lived experience at the table. And when I say at the table, I really truly mean at the table for policy-making conversations, for program development. Ultimately, we need to ensure that the services and supports we're designing are going to meet the needs of the individuals experiencing the mental health conditions in the community. And the best way to do that is by including them at the table, including them, including their families. And we have a very, very strong and deep commitment to do that. And one of the things I must say, and unfortunately, we cannot talk about treating mental disorders without talking about our justice system. I think that's sad. I don't think that's okay that we have to do that in this country, but unfortunately we do. So many individuals with serious mental illness and other mental disorders find themselves in jails and prisons. And we need to figure out collectively early diversion, alternatives to incarceration, get people care and treatment rather than putting them in jail. But if they are incarcerated, we also need to recognize that we have to treat those conditions while an individual is incarcerated. That is what will be the most successful path for reentry. We also need to provide reentry and follow-up services. So again, there's a lot of work to be done. There's a lot of effort that is collectively needed on this. I think the task before us is very, very large, but I am certain that with collective efforts, with groups like who are being convened today, I believe strongly that we can truly improve the lives of millions of North Carolinians struggling with these conditions. Thank you so much for the opportunity to join you today.
Thank you so much, Deepa, for your time and for your remarks. We look forward to working with you. And now I'm going to hand it over to Rob Lamb with Rob Lamb and Associates.
That's actually Rob Lemay, but good morning.
Sorry, Rob Lemay.
It's okay. It's okay. It's only happened like 80 gazillion times in my life, so don't worry about it. I am so happy to be here. Just for those of you who are joining us, I'm a lobbyist. Different associations, organizations, and companies pay me to represent them in the North Carolina legislature. I walk the halls of the legislature and talk to people like Representative Bobby Hanig, who you're going to hear from later this morning, and Senator Jim Burgin about a variety of issues. And I represent the American Foundation for Suicide Prevention, and I represent them for free, pro bono, because I lost a sister to the suicide epidemic a number of years ago. And this is one way in which I memorialize her. Her name was Anna Marie, and she was a wonderful person. And she got caught up in the epidemic at a time when none of us in our family really understood suicide or the signs for it. And it's left a giant hole in our family and among her friends. I suspect that many of you who are on the call today have similar stories or similar experiences, and they have motivated you to get onto a Zoom call on Friday afternoon to talk about mental health policy. So thank you for being here and doing that. And if you take nothing else from my talk today than this, it'll be a success. Your ability to tell that story, the story about why you are on this call, what motivates you to be on this call, that is all you need to be an effective advocate. If you tell that story in a phone call, if you tell that story when you visit the legislature, if you visit that story when you see your representative in your local community, if you send an email, whatever you do, that story is so important. There are many, many lobbyists like me. There are very few people like you who are willing to share the story of the impact of suicide and other behavioral health challenges to legislators. When you share those stories, you bring home in a really visceral, real world way the importance of the policies that people like me carry around in our briefcases and leave on legislators' desks. Those stories, if Representative Hanig or Senator Burgin has sat down over coffee with a constituent in his district and they've said, hey, I want to tell you about my sister, or I want to tell you about my father, or I want to tell you about a loved one. This is what happened, and this is what it means, and this is the impact that it's had on our family, on the business, on the children, on the entire community. Believe me, legislators take those stories and that experience of hearing first time real world stories, they carry that into the legislature. And then when people like me and some of the other advocacy professionals who are on this call walk into their offices and say, hey, I want to talk to you about this, then these legislators very naturally link what we're talking about with the stories of their folks back home. And it really motivates them not just to support us, but to be our champions. So there's a lot you don't need to know about all the policy. You don't need to know all about the committees. You don't need to know about all the budgets. You don't need to know all about that stuff to be really, really vital to this effort. All you have to do is send us a few emails and say, hey, I want to do this, or respond to an email that goes out that says, hey, we need people to let their legislators know that this is important, and let us help you link up to your legislator, either electronically or in person, hopefully, and tell your story. That's all you have to do. But there's no substitute. We cannot be effective unless people at the grassroots level are talking to legislators and telling their stories about why this is important. So I'm going to stop. I always talk too much. I'm a lobbyist, so I'm going to stop. And I'm just going to say thank you. And remember, you have everything you need to be an effective lobbyist right now, right? The legislators who represent you, they're real people. This is not Congress. This is the North Carolina General Assembly. Each one of these legislators has maybe 1 or 2 staff people. They talk to real people all the time. They want to hear from you. And we really, really need you to consistently tell your story over and over. And it's okay if you tell the same legislator the same story. They hear lots of stories. Tell it to them, keep telling it to them, build those relationships, and that will help us so much. That will help us so much at the General Assembly and with the administration. And if you can come to North Carolina, come to the General Assembly and help us do that in the lobby day, great. If you can't do that, there's lots of other ways to plug in. So I'm going to stop. On behalf, I know I speak for everybody, all the organizers of this of the Advocacy Day today when I say thank you so much for participating, and thank you so much for your willingness to share those stories. I know personally sharing those stories can be painful, can be a little awkward, but it's really, really important that you share them. So thanks. I think I'm going to stop there.
Rob, thank you so much. We appreciate you so much for everything that you do for us, for being here today, for all the work that you do, and all the work that you do in memory of your sister. You know, when talking about suicide, it's important to use safe messaging. Field advocates come from many different backgrounds. Some have lost a loved one to suicide, as Rob was just talking about. Some have had their own struggles or support somebody that struggles, and some are professionally invested in this space. Telling your story can save lives, but only if you share it safely. Sharing your story lets people know that they're not alone and shows them that recovery is possible. And if done safely, your story will encourage people at risk to seek help. Some things that you should remember: you should be in a safe place in your recovery. Avoid discussing details about method, as this could be triggering for those around you. Avoid glorifying suicide by using terms like successful attempt, and instead say death by suicide. Avoid using the word commit, as we often relate this to words of crime. Instead, say someone died by suicide or took their own life. There are mental health resources such as the National Suicide Prevention Lifeline or the Crisis Text Line. And finally, practice. The more comfortable you are sharing your story and talking about suicide, the more we can break the stigma associated with mental health and suicide. Next slide. As you begin your advocacy journey, it's important to note that there are many resources at your disposal. The state legislative website is a great source of information. There are several resources available to new and seasoned advocates that we also have on our website. If you're interested in learning more about specific policy areas that any of the organizations work on at a state and federal level, you can visit some of the links shown here. The Public Policy Office has also hosted and shared webinars and sample meeting videos for new advocates that are available. And you can learn where bills are in the legislative process. We'll talk a little bit more about the Action Center later in today's presentation. When speaking to a legislator or their staff, remember to be polite and thank them for their time, and be mindful of the language that you use as discussed in the earlier slide. Then share your connection to the cause, offer to be a resource, and include a policy ask. Remember to be brief and think of this as kind of an elevator speech. You may want to say something like, my name is Cothren, and I was impacted by suicide through the loss of a friend. I'd like to work with your office to ensure that calls made to the National Suicide Prevention Lifeline in our state are answered by a center within our statewide crisis system. I can share more information with you about AFSP or NAMI or Mental Health America and how we can work together to prevent suicide. And I'm happy to answer any of the questions you may have. You know, as you're talking with the legislative office, you don't need to know all of the answers. If you don't know one, that's okay. You can say something like, I don't know the answer to that right now, but I'll be happy to find that out and follow up with you as soon as I have the answer. And this provides you with an excellent reason to maintain communication with that office and further position yourself as a resource. There are many ways to utilize the state advocacy tools that we're sharing with you to build relationships and stay connected with lawmakers throughout the year beyond just today's event. As a volunteer field advocate with one of our organizations, you'll receive emails from the public policy team that will prompt you to email your members of Congress and state legislators. You can also meet with legislators or their staff throughout the year in person or virtually. And all of our organizations are happy to work with any advocate on talking points for meetings. There are also many of the meetings being held right now virtually, so there'll be some increased opportunities for advocates to become engaged in the legislative process because of that. The Centers for Disease Control and Prevention collects and shares data on the number of suicide deaths in the United States each year. It typically takes 2 years for this data to be published, and we are currently waiting on the verified data for 2020. So the most recent data we have to share with you today is from 2019. Suicide remains the 10th leading cause of death in the United States. In 2019, we lost 47,511 Americans to suicide, making it the second leading cause of death for ages 10 to 34, and the fourth leading cause of death for ages 35 to 44. Over a third of those who died by suicide were over the age of 55. It's estimated that for each suicide death, there are 25 attempts, which works out to be more than 1 million attempts each year. On this next screen, you'll see part of the AFSP National Fact Sheet. What you're seeing here is a comparison of suicide rates across the country, and you can see that North Carolina is actually in the lower third of suicide rates in the United States. That's the good news. But remember that even with states in the lower third of suicide rates, there's still much more work to be done. With the next slide, let's go ahead and break down the numbers for North Carolina. Suicide is the 12th leading cause of death in North Carolina overall, and suicide is the third leading cause of death for our youth ages 10 to 24. 55.91% of firearm deaths were by suicide in North Carolina, and 57.51% of all suicides were by firearms. Here's a copy of our state fact sheet that you can share with lawmakers and will be sent to you in an email. Our organizations are coming together this legislative season to speak with one voice on 3 policy priorities. Let me turn it back over to Kathy to talk to you a little bit more about that.
Thank you so much, Cothren. I'm going to take us right into a discussion about our first legislative priority, which is we're going to delve into the issue of safe gun storage, which can be so closely linked to suicide. Rob, thank you so much for sharing your story, and what you said is so true. Those voices of lived experience are very important. And that's why we're delighted to have Betsy Rhodes, who is a volunteer with AFSP, to introduce our next speaker. Betsy?
Good morning, everybody. I am a proud country girl from northeastern North Carolina. My kinfolk have been farmers and fishermen here for many generations, and it stretches all the way back to the 1800s. My daddy's daddy raised Black Angus cattle in Perquimans County, one of the first Black Angus cattlemen there, and my mama's daddy was a crop duster. I come from a culture where guns are not a luxury or some tough guy wannabe affectation. I come from a culture where our guns are a necessary tool of rural life. That said, my family tree also includes 4 suicides in the last 4 generations. 3 out of those 4 suicides died by self-inflicted firearms and their own personal firearms. In August 2003, almost 19 years ago, my 23-year-old son, Luke, died by suicide while attending grad school at UNC Chapel Hill. Since that time, the AFSP has taught me so much about mental health and suicide risk factors and how every family can build in protective factors to keep them suicide safe. One of these key protective factors is firearm safety and safekeeping. We know from our research that if a firearm is under lock, under safekeeping, that it buys time for the person in a suicidal crisis to get past the crisis or for someone to respond and intervene. This is crucial. It is my honor today to introduce a man who is doing something to make firearm safety a priority for every home in North Carolina, Representative Bobby Hanig. Representative Hanig hails from the 6th District, covering the counties of Currituck, Dare, Hyde, and Pamlico. He also serves as the House Deputy Majority Whip. Representative Hanig lives in Powell's Point, North Carolina, and he's a local businessman there, and he's also a U.S. Army veteran. Representative Hanig is one of 4 sponsors of House Bill 427, also known as the Firearms Safe Storage Awareness Initiative. On behalf of the North Carolina chapter of the American Foundation for Suicide Prevention, I would like to thank Representative Hanig from the bottom of my heart. Your work, sir, will save lives. Your work, sir, will prevent the tragedy of suicide for countless families like mine. And your work, sir, fills me with hope. Hope that North Carolina can be a suicide-safe community for all of its citizens. And now I give you Representative Bobby Hanig.
Betsy, thank you so much, and thank you for sharing your story, and thank you, Rob, as well. And thank you all for being on the call today and participating. Your voice is important in increasing awareness and mental health issues. I can assure you that legislators hear you, and we need to hear from you so we can understand the challenges we all face when it comes to mental health and suicide prevention. You know, we all have our own stories. You know, they're driving us to be here today, myself included. You know, as we all know, the last couple of years has really caused a dramatic increase in mental health issues, suicide attempts, and suicides. We need to increase that awareness, and we need to hear from you folks. Our offices are open. We need your guidance, and we need to be able to tell your story. It's very important to us. We don't know what effects, you know, the COVID pandemic has created, and we probably won't know that for years to come. But we do know that these issues are going to increase and that we need to get a hold of it. As you are aware, I did sponsor legislation to educate folks about gun safety and gun storage. You know, if we can prevent one suicide because someone picked up a gun and it had a lock on it and they weren't able to do it, that's a win. And we have to take our wins one at a time. It's really important that we get this legislation passed. You know, it's common sense legislation. It isn't mandatory. It's 100% voluntary. It's common sense. You know, 55% of, like they said earlier, 57% of the suicides in North Carolina came from a gun. That's troubling beyond words. You know, I'm a big gun advocate. You know, I hunt. I do a lot of target shooting. You know, in North Carolina, I think especially our Second Amendment rights are near and dear to our hearts. But there comes a time for common sense as well. So we need to do everything we can to save lives. And I think that's something that everyone can agree on. The legislation that I introduced, it passed through the House with one dissenting vote. You know, I had 119 to 1 vote on it. It went into the Senate. It wasn't moving for whatever reason. I think personally that, you know, the House is much more efficient than the Senate. I'm sure there's a senator on here listening, which is great. So it wasn't moving. So I actually got it put into the budget. And, you know, I was watching it throughout the budget process. As you all know, it took a long time for the budget to get through. It did get pulled from the budget right at pretty much the last hour before the budget, you know, got approved. So I'm confident that in a short session, with your help, we're going to be able to get this to move and get this to pass. Again, I can't tell you, it is very simple. It is common sense. Education is the key. We have to get this done for our folks. I can't stress enough how important it is to me. And I know it's that important to everyone else on this call. I appreciate everyone being on this call. We need to be able to help someone in their darkest hour, and to help for us to understand where someone is that's going to cause them to take their life. If we don't get a hold of that and understand that, we're in trouble, and a lot of people need our help. I want you to know that my office is always open. I'm always available. If you need to call me on my cell phone, call me on my cell phone. I'm happy to give that. You know, I can send it to you, but I can tell you my personal cell number is 252-207-5479. It's on my General Assembly business card. Call me anytime. Anytime I can help you. If you have someone in need and you don't know how to help them, call me. We'll find help. We'll get them to the right person. Again, I appreciate everyone being on the call. I'm glad to be here. I'm glad to have the opportunity to push this legislation. I know how important it is. Thank you all so very much.
Thank you so much, Representative Hanig, for your advocacy and support of this important issue, and for making yourself so accessible to those of us who want to help you get this legislation across the line. So again, thank you for being here and being with us. Our next legislative priority that we're going to be focusing on is the need for more school-based mental health resources. The Surgeon General issued a rare public health advisory recently around the crisis surrounding our youth when it comes to their mental health. And North Carolina has a lot of improvement to make, especially with regards to school-based mental health resources. So it is crucial that we find a way to increase the student to school psychologist and counselor ratio in North Carolina. Again, that voice of lived experience is so important. So with that, I want to introduce Carla Carlisle. Carla is a volunteer with Mental Health America of Central Carolinas. She is one of our volunteer storytellers. She is an executive with TIAA, an author, and a mom with lived experience who has navigated the complex mental health system to get the appropriate supports for her son. Carla, thank you so much for being here today. And I'm going to turn it over to you and allow you to say a few words and introduce our next speaker. Thank you.
Thank you, Kathy. And thanks everyone for having me. So I was thinking about what I wanted to share, and I think the most important thing that I can share with you is this journey that I've been on with my son. My son, JC, is 11 years old. He's in middle school. He came to me at 10 days old as a foster child, and he was with me for 6 months before he went back to his birth parents. I decided to stay in his life, and not as a foster parent, just as an independent person who loved him. When my son was 6 and I still had no legal rights to him, he tried to die by suicide twice. There was 10 days between the two different episodes. That led to a series of events, including him being put into behavioral health for observation. But I just want to pause and share with you how absolutely devastating and helpless one feels when the child that you love has probably not even the mental capacity to understand the gravity of his actions, but decided it was time to leave this earth, at least in that moment. It was one of the worst times I think I've ever experienced. The sense of helplessness is just overwhelming. That prompted me to get emergency custody of my son, and eventually I did adopt him. And as I mentioned, he's now 11. My son has diagnoses that include post-traumatic stress disorder, anxiety, and depression. He's an awesome kid, but obviously, he needs some additional support, having gone through so much trauma as a young child. When I listened to Rob and Betsy and Deepa and others, all of it resonated with me as I sat alone trying to find support for my child. Just recently, in this last year, with my son being in 6th grade, he had a mental health crisis, and we leaned on outside organizations to provide support. The school was not equipped with anything beyond really a school counselor who was strapped, one school counselor for the entire school. Prior to that, during my son's initial mental health crisis that led to me getting custody of him, I actually had started paying out of pocket to have a buddy sit with him to try to provide the support that he needed. Fortunately, as his advocate and as someone who is financially stable, I was able to do that. But I think about all the parents who are not able to do that. So my son has me, and I'm very thankful for that. And we have a huge support system, but there are so many parents out there, so many children out there who don't have the support. And our kids spend so much of their time in school. This is where real change can happen. I don't expect the school psychiatrist or psychologist or counselors to be miracle workers, but certainly they can advocate on behalf of our kids. And they can't do that when they have 1,200 kids assigned to them. It's just impossible to do. I listened very intently to the calm presentation and the talk about, this is a moment in time that can pass. And I think about that with my son, and I have to just tell you that I didn't care about the stigma of mental health. My concern was that my son lived to see the next day, and he's thriving. Again, what happens in our schools in terms of supporting our kids in their mental health is so very critical. And we just don't have enough support in schools to help our kids, especially with the pandemic and all of the changes we've seen. So I just want to give my sincere appreciation to Senator Jim Burgin, who represents Johnston and Lee counties, for his work to introduce legislation and to support mental health in schools. It is very critical. And I don't think at this point that there's one child that hasn't been impacted in some way through this pandemic. Everyone's life changed, but our kids need support that they simply right now don't have. And so with that, I'd like to again thank Senator Burgin and welcome him to this event. And we look forward to hearing everything you have to share. And please continue fighting the good fight for my son, JC, and all the kids out there who desperately need support in our schools. Thank you.
Thank you, Carla, and I'll be praying for JC and you, because I think that as people of faith, that's something I think makes a difference. So stories are real important. I think you remember stories. A guy that works here at the building had very serious shoulder surgery, and I asked him what happened, and he told me this long, drawn-out story about a cow, and then he finally admitted that he had slipped on ice back when we had ice and fell. So, and I saw him this morning, and I said, I'll always remember you for the cow story. So we do remember stories. Let me tell you a story that troubles me. I'll tell you two stories that trouble me right now about mental health. One is a 16-year-old girl. Her dad called me on a Friday. I've known this man for 20 years. He's a senior vice president of a large company in North Carolina. And he called me and said, Jim, my daughter is in Atrium. She was involuntarily committed. She's 16 years old, and she tried to kill herself. She's been here 8 days. They can't find any place for her to go. They won't let us take her home. What can I do? He said, they have called and called. And so I immediately got on the phone, called some of my contacts, who called some of their contacts. And they said, we can get her in a bed in a facility in Raleigh tomorrow. And I said, okay. Then they called me back and said, well, we can't transport her. They can't transport her. She has to be transported by a sheriff's deputy. And they said it could be 72 hours before we could transfer her. So I called my sheriff in Harnett County, who called their sheriff. And so in about 20 minutes, we got her moved. Now, folks, it shouldn't take a North Carolina senator to make that happen. That ought to be automatic. And that's what I'm working to try to do. I'll tell you another story. I had a mother, in fact, I talked to her yesterday while we were voting on the Free the Smiles bill about masks, but she had called me a few weeks ago, and her child is in a school that still required masks. She's 6 years old. She will not take her mask off unless her mother makes her, because she said, why don't you want to take your mask off when you're here or when you're outside? And she said, because I'm afraid I'm going to make you and daddy sick and die, or make my grandparents sick and die. And that little 6-year-old girl had somehow in her mind, from either hearing, reading, listening, talking, that she was going to kill her parents if she didn't wear that mask. And folks, we've got a whole group of kids that I'm very concerned about, and adults, but mainly kids that are dealing with this. Now, the girl that was the 16-year-old that tried to commit suicide was a straight A student, very social. And the reason that she did it was because her grades, when it became virtual, she went from being a straight A student to being a B, low B student, which just, I think, devastated her. And that and being away from her friends were the reasons. Now, we got her through a treatment program. We've got her in counseling now. And I talked to her dad not long ago, and he says she's doing fantastically well in the program. How many, though, are we not getting services? Carla, you mentioned foster care. Did you all know the average foster care child goes through 7 different housing situations. Now, any of you, and I don't know how many of you have children. I have 3 children and 4 grandchildren. I was at a hospital talking to the CEO, and he was telling me about an involuntary commitment of a 9-year-old girl that had been there 29 days. Same thing, calling, no place to take her. Had not been outside, had not been anywhere, had been in an emergency room environment for 29 days. Her foster care mother had taken her there. And so it was an involuntary commitment. All she had was the clothes on her back. The nurses were buying her stuff, buying her coloring books, buying her clothes and things. So I got on the phone with the secretary and we made arrangements and we got her moved. This budget has about $675 million of new money in it for mental health and opioid treatments. And one of the things that I want us to do is to have a program where we don't take kids to the emergency department, emergency rooms for involuntary commitments. I don't want us to even take adults there. They're just not set up to do it. And it's going to start in the schools. We budgeted for 1,500 new school psychologists, and that's great, but they're not available. I mean, we don't have the people trained to go into the schools, even though we funded those positions. So we're going to start using contractors and other things. So encourage people to become school psychologists. Encourage people that we still have 30 counties in the state that don't have a psychiatrist in them right now. That we've got to fix that. I'm looking at ways to fund people to become psychiatrists and primary care physicians and go out and work in the rural areas. The rural parts of the state, I think, are some of the most highly affected. And I read an article the other day that said that, people in the farming community are now experiencing higher rates of suicide because a sense of angst about, their future and everything. But most of this to me gets back to a feeling of hopelessness that a lot of people have now. And I'm a person of that faith, and I think faith has a lot to do with that. And I'm not going to try to, go into a sermonette or anything, but I think we, as responsible citizens, elected officials, need to talk to folks about talking to people, being with people. This isolation has been really hard on folks. I think it's been the hardest on the youngest and the oldest among us. I have seen people that their mental health has failed drastically over the last 2 years. People that were vibrant, social people, but because they were told to stay home and wear a mask, they have become much more solitary, depressed. I just think that those things are happening. So some of the things I'd like for us to do is work with all of our teachers. Every teacher needs to have a cheat sheet or a card in her desk with the however many warning signs we want to put on there. We need. I don't expect the teachers to become school psychologists, but if I know that the 5 warning signs of a heart attack are this, and this, then or the 5 signs of a stroke, I can know that as a consumer and as a friend, that if I see somebody that their mouth's drooping and I tell them stick out their tongue and it goes to one side, I can say, you might be having a stroke. Let's call 911. We need to, first of all, we need to have the little indicators that we do. So we start with our teachers. We train our teachers, our counselors, all of those folks, so that they know the first signs. They can see that quickly and try to do something about it. And then just out of the science, and I don't know, this would be a good discussion with the psychiatrist and everyone is, how long does a mental health episode last? Carla, when you said that your son tried to commit suicide and then, so many days later tried it again, that, I don't know. I always thought that a suicidal episode was kind of like a point in time, and as somebody kind of steps back from it 24 hours later, they say, oh, that's better. They talk to somebody or they call the suicide hotline. So I would want to dig into that more. Secretary Kinsley and our dear friends, we were texting this morning. We talk about every day, but we're talking about doing a statewide visit where we go to different places in the state and we have mental health summits and invite people to come in, tell their stories, bring in the psychiatrists, bring in the folks, and really look at what we need to do to change this whole dynamic. I mean, nobody wants somebody to commit suicide. That is one of the hardest things for the people that are left to ever get over, because the rest of their lives, they deal with the, what should I have done, could have done, what didn't I do? You know, I had a brother-in-law that was a Vietnam veteran, came home. I think now looking back and talking to folks that he probably had some bipolar situations or schizophrenia. I mean, I don't know that he was ever diagnosed. He did different medications, I think, to try to do it. But he got to the point where one day, my sister had actually moved out because of issues that were going on. But he just took a gun and sat down in front of his refrigerator and killed himself. And so my niece, his daughter, has always dealt with that. You know, she's in her late 40s now and is dealing with that. And so the people that are left, it affects. So look, I am committed to working on mental health in North Carolina for all of us, for the kids, for all of us, for the folks that are older. I think you cannot be a healthy state if you don't have great mental health. I think that is so part of your physical health is your mental health. I think you can actually almost will yourself to be better in other things if you do have good mental health. I've known people that have got terrible physical diagnosis about cancer or something, but their mental health was so good that they willed themselves. I'm not saying you can heal yourself, but I think mentally you can help yourself through the healing process. So I look forward to working with everybody. I'm anxious to hear from anybody that's got some great ideas. I think we need to be willing to try things. I read a book a long time ago called Technotrends, and it says, learn to fail fast, meaning let's try things, see what works, add to those things, but the things that don't work, let's don't keep paying for those and wasting our money. You know, let's find out what really does work for folks, especially our kids, because that block to me right now is the most important. That these kids that have been that aren't mentally able to cope with what's happened to them the last 2 years, I want that to really be a high focus for us. So happy to be with you all. I'm going to have to check out in just a minute. We have Medicaid expansion hearing going on in the auditorium right outside of my office. So I'm getting ready to go over there and be involved in that. A lot of y'all have an interest in that because there's a lot of money that I think we could bring and use into mental health out of that money. So I just look forward to working with you all. Let me know what I can do to help. Okay.
Yes,
and Carla, you keep your son JC in good stead. Okay.
Thank you so much, Senator Burgin, and thank you for being a voice for more resources in the state around mental health, particularly youth mental health. And we look forward to the conversation continuing around Medicaid expansion as well. Thank you for being here.
You all have a great rest of your meeting. Bye-bye.
So we're going to quickly go into our next and final legislative priority, which I know you've all been hearing a lot about, 988. And we're really thrilled to have Hannah I'm going to probably butcher your name, Wesolowski, join us. She is the Chief Advocacy Officer for NAMI National, and has been doing a lot of work on the federal level around important priorities relating to mental health. So Hannah, we are so happy to have you here to talk about 988, which is such an important implementation that's coming up. So I'm going to hand it over to you, Hannah. Thank you.
Thank you, Kathy, and you did a beautiful job with my name, so thank you. Hi, everyone. As Kathy said, I'm Hannah Wesolowski, and I'm with NAMI's national office, and it is such an honor to be with you all with NAMI North Carolina and AFSP and MHA, such valuable partners in this work, and really excited to talk about this with you all. I know there's been a lot of discussion this morning about the importance of sharing stories, and I just want to emphasize how important that is. Your stories are critical to impacting legislators and informing them on what would help or what they can do. And nowhere is this more important than when we talk about crisis response. And I think we just heard the senator talk a bit about the calls that he gets, and that only a few people who are able to call a senator or representative sometimes can get that help, and that shouldn't be the case. And this is really a critical time for crisis response. In 2020, Congress created 988, which is a nationwide number that will connect to the National Suicide Prevention Lifeline. But 988 will focus on both suicide prevention and mental health crisis response. So every phone carrier must direct calls to 988 to the National Suicide Prevention Lifeline by July 16th of this year. So it's coming in just a few months. NAMI, AFSP, MHA, and others have been working at the national level in North Carolina and in other states to ensure that 988 is more than a number. 988 can be the entry point to a crisis continuum of care. While the federal government's providing some resources, much of this is happening at the state level. And currently, how we respond to crises across the country is it's not enough. We face trauma and tragedy far too often, something that I know many of you are all too familiar with. We can always do better, and 988 is an important opportunity. In fact, it's a once in a generation opportunity to do this right. So when you talk to policymakers, it's important that they understand what 988 is and what it can be. If you don't mind jumping to the next slide. So this is just an overview of the crisis continuum of care that our organizations are working on. A true crisis system doesn't end with a number. We need three components: someone to talk to, someone to respond, and somewhere to go. The first part is 24/7 local crisis call centers. Calls to 988 are answered by trained crisis call operators. This is to ensure that all calls to 988 can be answered in state, connected to resources in the state. So we want those operators in North Carolina. We expect that as 988 rolls out, as people become aware of it, demand is going to increase significantly. And we need to make sure that North Carolina has the resources to respond to this increase in demand. For those who cannot be de-escalated over the phone, we need mobile crisis teams. This ensures a mental health response to mental health and suicidal crises. Too often, we rely on law enforcement to do a job that requires a healthcare response. Mobile crisis teams should include behavioral health professionals that are able to de-escalate situations and identify additional areas that they can help an individual. And sometimes people need further care. When that happens, they should have somewhere to go. Unfortunately, emergency departments often struggle to help people in mental health or suicidal crisis. Crisis stabilization facilities offer an alternative that can provide a safe, home-like environment that de-escalates the situation and connects people to additional supports and services and care in the community. If you don't mind going to that, great, thank you. So what happens when this system is in place? This chart kind of shows that. Unlike 911, which takes phone calls and dispatches emergency services, 988 call centers can actually resolve about 80% of the crises that come into them over the phone, because these are trained crisis counselors who are answering these calls, and they can really de-escalate so many of these situations. But when the full crisis continuum of care is in place, many other crises can be part of this to keep people in the community connected to care and really reduce law enforcement involvement, hospitalization, incarceration, and tragedy. And law enforcement should be able to hand off anyone in crisis at any point in this continuum. This is really about connecting different emergency services to make sure that we're getting people help as quickly and urgently as possible. And I hope you all agree with me that we all deserve access to this type of care. Next slide, please. So as I mentioned, when 988 rolls out, demand is expected to skyrocket. People will start learning about it. There are the calls that are currently going to 911 that'll now be directed to 988. There are people who didn't even know there was an option of someplace to call for help previously. State support for and investment in crisis response systems and call centers within this Lifeline network is critical. So the federal government funding for crisis services is actually somewhat minimal. The state gets some money in the mental health block grant every year, and there was a recent opportunity that North Carolina can pursue to ensure Medicaid coverage for mobile crisis teams. But beyond that, it's pretty limited. Call centers directly don't receive any federal funding. They receive a small stipend from the Lifeline every year, only about $2,500. That's not going to keep the doors open. They're also able to apply for some limited grant dollars. While the federal government does fund the Lifeline, that largely goes to the national network to support call routing, best practice standards, public messaging, and technical assistance. And basically how 988 will work is you will call, and based on where you live, you will be directed to a local call center. If that local call center can't answer, your call will be directed to a national backup center to ensure that anyone can get connected to a trained crisis counselor. But as much as possible, we want those calls answered locally, again, so you can be connected to local resources. With this increase in demand, we need to make sure resources are in place so North Carolina can respond to everyone in the state that's in need. Plus, we need to continue to build out those additional crisis services that I mentioned for this continuum of care. So what can you do? First, as Rob said earlier, your stories matter. Share your stories with policymakers. Tell them about your experience or your loved one's experience in a crisis, and let them know what would have led to a better outcome. Many policymakers are unaware of 988, or they might think that the work is done, the number's going live. They need to know that we need to build up these services to ensure that everyone can get the response and help they need, no matter what type of service they require under that continuum of care. The North Carolina Division of Mental Health, Developmental Disabilities, and Substance Use Services has been working with the Lifeline Network member, Real Crisis Intervention, Inc., in collaboration with a state work group that some of you are part of, to create a roadmap for 988 implementation. So while that's rolling out, you can ask your legislators to support future legislative efforts to provide sustainable funding for 988 services. We need something we can depend on year after year. For Real Crisis Intervention, Inc. and local crisis call centers, we want to make sure they have the resources to answer those 988 calls, and we want to make sure that continuum of care is in place across the state. The state should invest general funds to support those local call centers in this future 988 system. So talk about why that would help. Talk about how that will reduce healthcare spending by providing early intervention, reduce the burden on emergency rooms and hospitals, and on our law enforcement. About 20% of law enforcement calls are responding to mental health crises right now. So this can really change that paradigm and that conversation. But ultimately, putting this system together will improve outcomes for individuals experiencing a mental health or suicidal crisis. And your stories can help highlight the importance of that. Thank you so much for being with us today. And I really appreciate this opportunity to talk about this. My contact information is here, so please reach out if you have any questions on this topic. Thank you all.
Hannah, thank you so much for being here and giving this perspective on 988 implementation. I know this is a huge undertaking, but it is moving us in the right direction. So we do have to see this as a positive around mental health. So real quickly, I'm going to turn it over to Sarah Cothren with AFSP so we can begin our wrap up here. Sarah?
Hi, everybody. Thank you, Kathy. As Kathy said, my name is Sarah Cothren, and I'm the North Carolina Associate Area Director for the American Foundation for Suicide Prevention. I'm going to take the next few minutes to discuss how you can take action to support the policy priorities that we reviewed during today's presentation. So each of you should have received an email prompting you to visit the AFSP Action Center to email your legislators in support of the policies that we discussed today. For those looking to take additional action, you can share a personal vignette before or after your legislative meeting, and we'll discuss the vignettes in more detail in just a moment. I also want to remind you that an incredibly easy way to promote mental health and suicide prevention is by posting on your social media. We encourage you to use the hashtags OneVoiceNC and AFSP Advocacy. We would also recommend that you tag your legislators in your posts. As I said earlier, the AFSP Public Policy Office has set up an action for you to take within the AFSP Action Center for today's event. Advocates are directed to the AFSP Action Center at the link you see here, the afsp.org/action center. Once you're in the Action Center, you can email your legislators in as little as 2.5 minutes. The Action Center is pre-programmed with letters to elected officials, which are then populated with your contact information and any personalization that you wish to add. And don't forget, you can also share the general link to the AFSP Action Center that you see on the screen on your social media outlets and encourage your friends, family, and community to join you in taking action today. The action for today's event will remain posted for 1 week after today's event. For those who plan to meet with their legislators or their legislators' staff, there are a few things to keep in mind. First, practice your elevator speech as we discussed prior, and make sure that you feel comfortable sharing your story. One easy way to practice is by filling out a written vignette that can be shared with your legislator's office. The vignette could include a photo of you or your loved one and a few sentences about why suicide prevention and mental health are important to you. Typically, legislative meetings will last about 10 to 15 minutes, so you may not have time to talk about every priority discussed today. This is why we encourage advocates to select one area from the issue brief that they are passionate about and talk about that during your meeting. Legislators have received an electronic copy of the issue brief and state fact sheet from the Public Policy Office. So if you're not able to talk about every priority, that's okay. Finally, don't worry if they ask you a question that you don't know the answer to. You can simply say that you don't know, but we'll be happy to find the answer and follow up with them. This gives you an opportunity to stay in communication with the office and build your relationship. The AFSP Public Policy Office is happy to work with all advocates to answer any of the questions that are asked so that you can follow through on your promise to be a resource for your legislators. After meeting with a legislative office, it's important to follow up and offer yourself and our organizations as a future resource. You should send a personalized thank you note and a copy of your vignette if it was not shared prior to the meeting. The vignette provides a legislator and their staff with a name, a face, a story, and ultimately a reason to vote in support of suicide prevention and mental health. To wrap up this session, we have a few final reminders to share. Please, if you meet with any legislators, fill out an electronic legislative meeting feedback form. The link to this form will be shared with you shortly. This feedback is important as it lets us know who you met with, what issues were discussed, and if any follow-up is needed by our organizations. If you received a question during your meeting that you didn't know the answer to, the electronic legislative meeting feedback form is where you can share that. After your meeting, please send a thank you email to the legislative office and offer our organizations as a resource for suicide prevention and mental health legislation in the future. We have a sample email template available that I'll also send out shortly after this event. Please let us know what you thought of this event overall by completing the event survey, which will be sent out shortly. We want to make sure that this is the best event possible for each one of our advocates, and we really appreciate your feedback. It'll help us improve future events. Finally, if you have any questions or need any support, feel free to reach out to me at scothren@afsp.org. My email address is on that slide.
Thank you so much, Sarah. I just want to thank all of you on behalf of AFSP, NAMI, and MHA for joining us today. We know that advocacy really is most effective at the grassroots level, and so you and your voices and your continued advocacy efforts are so important to lift up the issues around mental health that we've shared today. I hope you'll continue to stay connected with our organizations, and we do plan to have a big Capitol Day in Raleigh sometime in May, and I hope that you can join us for that and be able to visit your legislators one-on-one. So again, thank you for being here. Thank all my colleagues at AFSP and NAMI. It's been great. And with that, it is 2 minutes past 10:30. So we did pretty good. So thank you all for being here, and all of you who spoke today, your voices are so important. Thank you.